Hey, welcome to the Elle Russ Show, where we explore ways to get healthy, wealthy, and wise. With a combination of guest interviews and solo episodes, I hope you will be inspired and motivated to become the best of whatever you are. I'm Elle Russ, #1 bestselling author and subject expert with over a decade of helping thousands of people across the globe. Visit my website, elleruss.com, to learn more about free guides, masterclasses, online courses, and more. Enjoy the show. Today we have Dr. Neil Sadick. He is one of the most influential and renowned dermatologists and researchers in the world, known as the doctor's doctor. He's had so many discoveries that have influenced and transformed the future of dermatology, and he's authored over 290 journal publications. He has contributed to Vogue, Cosmopolitan, Elle, and so much more. But today we're going to focus on happy feet, happy life, particularly in the arena, this niche of toe fungus, which is a struggle for many people, and everyone's seen the multitude of ads about it. So clearly, if you're struggling or you know someone struggling, send them this episode. Dr. Sadick, welcome to the show.
Well, thank you so much, Elle. Thank you.
So you've done so many things. You between cosmetic surgery, facial rejuvenation, lasers, all of it. What led you into toe fungus? What got you excited about that topic?
Well, eventually, if you start on top, you end at the bottom.
That's right.
So that was one area. But really, I've always had an interest in the lower extremity as well. I helped to develop sclerotherapy in the treatment of leg veins around the world. And of course, the toes are part of the lower extremities, obviously, and it's gaining increasing concerns and new treatments that are really much more optimal and beneficial for patients. That's what led me into that. And the whole concept of teledermatology, I think, is an emerging area of how healthcare is going to be delivered to patients in the future.
So let us just understand this topic a bit, because most of the time, I think people, at least the people that I've spoken to that have had struggles with toenail fungus, it's like they went to go get their nails done somewhere and they claim that that's what gave it to them. And again, sure, that could be a cause, but what causes this? How can it develop? Is that the only way you get it, or are there other things we need to talk about? We will talk about hygiene and all of that in a minute, but how do you get it?
Well, toenail fungus occurs usually from exposure to a fungus in the environment. It occurs commonly in people that walk without shoes on or without socks on, that walk in non-hygienic places, soiled places, beaches, etc. So there's genetic predisposition, but it's an environmental contact that really causes the problem.
And how does it develop? I mean, so like you quote unquote catch it and then it expands and continues until you stop it?
Well, it usually begins by having the fungus introduced between the toe webs. Usually there's a small micro fissure or little opening space that occurs between the toes, and the fungus then will inhabit that area and then spread to the rest of the toe or foot. And then usually it will also involve the nail at some point, which is, the most difficult area to treat because it's a very thickened area and it's hard for any medications to penetrate. And up until now, we really have not had great treatment options for treating toenail fungus.
And why is that?
Because most of the treatments that have been used to date have not worked all that well. They've had very plus-minus efficacy. And it usually takes a long time. Sometimes you need to treat yourself for up to a year before you can see good clinical results.
Wow. That is a very... Is there the philosophy of attacking it internally and externally, or do you just attack it externally?
Well, I think, to have penetration into the nail plate itself, it's good to have an inside-outside approach. In the regimen that we've developed for Stride, we usually have patients stay on antibiotics for several months, up to 6 months, and use a topical preparation. We've developed a revolutionary new product called Clear Nail Renewal, which allows improvement in the physical appearance of the nail just after a few weeks. And then the oral medication allows the fungus to be eradicated long-term on the nail plate.
Why is it more common than most people realize? Because this affects millions of people every year.
It does, and it's because people are exposed to, the fungus in the environment. It's almost every place, and not everyone practices the best hygiene on their feet. They practice excellent hygiene on their face. Everybody, almost everybody does. People wear sunscreens on sun exposed areas, but the feet really has not been an area that's had the most attention paid to it in the past.
Yeah, I mean, even when people like, I've been in the shower and like half-assed sort of washing the feet occasionally, but I've also been a victim of this in the sense that I haven't gotten toenail fungus, but I've gotten athlete's foot before and things like that at gyms and other places. So I'm very weary of that. Let's talk about preventative foot care. Let's talk about how one can have the proper hygiene and lifestyle habits so that they can avoid this. And then also maybe what to do if they think they might have been exposed or something, and they were like, "Oh, I was in this environment that was a little sketchy. What do I do now with my feet?" Or to maybe ensure that something doesn't, grab hold.
Well, I think the best thing to do, as you said, is to practice good hygienic measures. That is to not walk barefoot whenever possible. You should wear socks and or shoes. And if you're in a sweaty environment, to sort of change your socks, over a regular period of time. And then if you're exposed to, for example, moist soil, et cetera, or at the beach, when you come out of the water or leave the beach, to take a cool shower and then wash those areas with a good antiseptic soap as well. That will minimize the chance of the contracting the fungus or having the fungus spread.
I also contracted ringworm on my leg from the beach.
Ah,
So you
okay,
are
there you
correct.
go.
There's a lot of nasty stuff out there, guys. Uh, so yeah. Now, what about though? I mean, look, people love walking barefoot, and I'm part of the paleo primal ancestral community and that minimalist footwear, and people like to walk around barefoot. But again, if you're outside or in foreign environments, maybe not the best idea. The one thing too that a lot of people like, I've talked to friends about this before, doctor, and I feel like people aren't doing it. I do it all the time. Like I wash my gym shoes every now and then and I leave them out to air dry and I take the insoles out. A lot of people who's got the stinkiest, nasty shoes in their closet, and it's like you can throw them in the washing machine, people. You know what I mean? So that's another tip as well. Is there anything else like non-obvious that we can think about?
Well, just as you're saying, you can also there are antifungal powders like Zeosorb powder that you can put into your shoes also that will keep the shoes dry and prevent overgrowth of fungi. But in general, it's keeping the feet dry and clean. Those are the basic tenets of good foot care.
What are some early warning signs? What are some, I mean, obviously anyone can go visually look up an image, but what are some things to let people know about that if they're looking at their feet and they're like, uh-oh, I think I might have toenail fungus. What are those early signs? Because I know that early treatment is really important. So what are the things people need to be on alert for?
Well, for toenail fungus, the major finding that you see is usually a yellowing or thickening of the toenails. That's a prime sign that there's fungus involved. Often you'll also get crumbling of the nail as well, the nail plate itself. But commonly, this will also be associated with scaling and itchiness or uh, eczema like changes between the toes as well, or on the bottoms of the feet with fissures, etc. Those are the main clinical signs of fungus infection of the toenails called onychomycosis, or a fungus infection of the feet called tinea pedis.
How long did it take you to develop the treatment that you have for this?
Well, this was developed over the last 6 to 12 months. We tested a number of different treatment protocols and found this dry treatment protocol, again, using the oral antifungal antibiotics for 6 months, and then using this excellent topical preparation that I mentioned called the Clear Renewal to be the most effective in giving the most rapid treatment results and the greatest long-term efficacy. The problem often with fungus infection of the feet and nails that there's a very high recurrence rate. So sometimes you need to continue treating topically even after you've eradicated the fungus.
Mm. Okay, switching gears here. As a dermatologist, what are some other things? I mean, obviously we know about skin exposure and making sure people get their skin checked and all of that. But in as far as, look, there's like a million new Facial rejuvenations. And, I live in LA, right? There's like all over the place, but we've got lasers, there's, microneedling. What is something that you see that's out there that looks promising or exciting, or something that you're like, hey, that looks really interesting and beneficial, as far as just not obviously toe fungus, but as far as cosmetic? Because I know that's obviously on everyone's mind as they age.
Well, one thing that we're doing now is something called cell banking. We're able to pull a number of hairs from your scalp and have them banked in cell banks, and they can be used for development of cosmetic procedures or for anti-aging skincare products at any point during your life. It's called cell banking, and it's one of the newest, hottest areas, again, in aesthetic dermatology and aesthetic medicine.
And give me I'm a 10-year-old and I need to understand this. They're taking from my hair, looking at my personal DNA. Give me the process of how then it's creating something beneficial for me.
Well, what happens is when you pull the hairs are very active metabolically. So if you're able to put them in the right environment, you're able to multiply the cells in your hair follicles in an unlimited fashion if you're able to preserve them. So then you're able to take those cells at any time during your life and being able to create skincare products or to use them after any cosmetic procedure, so that's what that technology is.
That's fascinating. Um, what else do we need to consider when it comes to foot health or this issue of toe fungus that thankfully you've worked on solving for everybody? What are some things that haven't been discussed we might need to cover?
Well, I think another area on the lower extremities are varicose veins and peripheral vascular insufficiency. Very commonly, people later in life will develop these bulging veins on the legs, and they can be associated with pain or ulceration. But we have new techniques that can treat them non-invasively, non-surgically. So that's also another major advance. So foot and leg care itself stands alone. And also, the treatment of nail fungus and fungus infection of the feet is not just a cosmetic issue because they can get secondary effects such as cellulitis or infections in the skin of the lower extremities that can lead to hospitalization with the need for IV antibiotics. So if you see any redness going up your leg, if you have a history of thickening of your nails or fissures between your toe webs, then you certainly should look for medical care to make sure none of these have occurred.
That's right. Early intervention that speaks
Yes.
to that so that it does not spread. And also a good warning, guys, something simple that you think is isolated can cause later bigger problems. And
Right.
so catch it as soon as you can. Um,
I mean, the most common signs of nail problems on the feet or fungus on the feet, again, are fissures between the toe webs, thickening and yellowing and crumbling of the toenails. And then sometimes you can see redness or infection crawling again up the feet and even up the legs. So if you have any of those progressions, be sure to consult either a dermatologist or a podiatrist or an expert in foot care.
Throughout all of your years doing what you're doing, aside from this, you're obviously passionate about it. What are some really exciting things you've worked on that stand out of all of the things you've researched, you've been a part of in your journey, in your career? What are some standouts to you that were really interesting and fun to work on, or something that just fascinated you?
Well, I helped develop the first laser like technologies. I don't know if you've ever heard of the IPL,
Yes.
photofacial. Yeah, we actually worked on that and developed that during my residency at Cornell.
Wow.
So,
So really on the cutting edge of that, because now you
right,
can just walk into like a local facial place and get an IPL laser treatment.
right. So I was involved in the development of some of the earliest lasers. We helped to develop some of the earliest technologies that were used to treat cellulite, for example, like the Vela shape and the Vela smooth. And we've also developed a number of radio frequency and skin tightening non-invasive technologies as well. So we've been on the cutting edge in technology development, and then more recently we've also had an interest in the treatment and stopping of hair loss. So we were involved again during my residency in the development of Propecia, which
Mm.
is still the number one male uh, anti-hair loss treatment, but that led to other things, development of oral minoxidil, low dose that's commonly used now. We've developed a laser more recently that also can stimulate hair growth called FAACS. I just came back from China and Taiwan, bringing that to that part of the world. So we've been very helpful, again, in slowing down hair loss and regenerating hair with or without hair transplantation surgery.
That's fascinating. And everybody, for this topic, and we'll put it in the show notes, but if you want to tackle toenail fungus, definitely tackle it with this guy who's been on the cutting edge of all of these things over the years. And you can go to getmystride.com to learn more about that. And of course, we'll put all of the other links as well to connect with you. What else would you like to share with our audience before we leave?
Well, I think another area is the concept of whole body rejuvenation now, and the
Yes.
concept that we don't want to look people to look artificial after having either a Botox-like treatment or a filler-type treatment. The new concept is the new natural. When you come out of our office, you should not look like anything has been done. You should just look a little bit fresher and refreshed rather than looking, blown up or anti-age like that by itself. So the concept of whole body rejuvenation, hand facial rejuvenation, and the new natural are, again, some other trademarks that we've helped to develop. Again, slow down the aging process and give a more natural long-term appearance for people. That's really what they want. They want to look healthier and better, not necessarily young or artificial.
Yeah, and I laugh thinking about, we have a code word in this town where I live because you see some of the craziest plastic surgery ever. I mean, stuff where you're like, wow, I didn't even know that was legal to do that to lips or things like that. And we used to call them Beverly Hills Science Projects because literally they look like science projects. Guys, you don't want to look like a science project. And also answer this for me. Why is it sometimes it seems to be the case that when people, obviously they're doing it wrong, but when people do fillers and things like this, it can almost make them look older. Does that make sense? Do you know what I'm saying? Sometimes it almost ages people a little bit if it's overdone.
Exactly. If the placement is improper, you can get sagging, you can get bloating, you can get artificial type of appearance, and you can have an acceleration of wrinkling. So you must go to someone that understands the concept of pan-facial structural rejuvenation, or what I call the new natural. Extremely important.
And isn't there new technology in terms of like, back in the day, like now they have sort of like mini facelifts and different things that are less invasive than before and are kind of like quick and out the door and low recovery?
In general, the concept is less is better, more natural is better. And unless you are extremely aged, where facelifts still play an important role, you want to do something that gives the most natural aesthetic appearance.
Yeah. And where should people go? We'll put that in the notes too, but where should people go if they're not interested in the toenail fungus, but interested in some of the other things perhaps you're connected with in terms of the cosmetic world?
Well, Sadick, www.sadick dermatology. You can connect with us on Instagram. That would be very, very helpful. And then you can also read about all the scientific advances. We run one of the largest aesthetic research groups in the world, and I'm very global. I just returned from China and Taiwan, but I travel globally almost every month to bring in these new technologies so that people can appreciate and feel better about themselves on a worldwide basis.
I love it. Well, thank you so much for your time, and I really appreciate all the work you've done over the years. And everyone, if you're worried about tongue fungus or you have a friend who's struggling, get them over to getmystride.com, and then we'll put the other links to connect with him on the cosmetic stuff. Is there anything you'd like to leave with our audience before we go?
Don't forget your feet. Wear a
Yeah,
sunscreen every day and try to look natural, not necessarily younger.
love it. Thank you so much.
Have a great day.
And everyone else, we'll see you next week.
Hey, thanks for listening. If you enjoyed this show, I would so appreciate you leaving a review on Apple or Spotify or wherever you get your podcasts. And to learn more about partner discounts on amazing products, visit elleruss.com/discounts.